And I think infants, we can tell really easy. In fact, if I had a room full of infants and one had increased intracranial pressure, I would know. It's like nails on a chalkboard, high-pitched crying. It is so different than a normal infant's cry. Also, increased intracranial pressure, what would you see in an infant? Maybe it's the bulging fontanelle. Sometimes it could even be their scalp veins start popping out because of all the pressure in the head. But that high-pitched cry, and they're usually, you cannot console these infants when they have this pressure, this headache, and when they're neuro appearing. All of the following increase cranial pressure except what? Now we're taking care of children, we're taking care of adults, they've had a head injury. We need to know what we can do and what we can't do, right? So if we're turning a patient or if we are suctioning them, which can gag, these all can increase intracranial pressure. So if we're already at that brink of too high, we are going to do these as sparingly as possible. We're still going to give patient care, but maybe we'll sedate the patient or give an extra dose of something before we turn them, before we suction them. But increase in heart rate does absolutely nothing, nothing. Which of the following signs and symptoms are more common in children than adults following a head injury? So in children, they tend to vomit, okay? Adults don't most of the time, okay? So if you see an older adolescent and they have a head injury and they're not vomiting, don't think it's less than what it really is, because they're not going to be that person who vomits. It's the younger children. What medication may be used for a child with cerebral edema due to a fall? Well, cerebral edema, head, too much fluid. What is the medication we can use for the head to get rid of fluids? What's the best? I know I taught pharmacology, so I know how I describe that medicine. It's mannitol, only head, okay? It can sometimes do with some renal failure and toxic stuff, but basically mannitol is for the head. Furosemide's more for lungs, peripheral edema, but the mannitol works directly to get that fluid down, to decrease that pressure in the head, which is what we want to do when we have cerebral edema. Ray's syndrome, what's that? Sort of mentioned it back when we were talking about Kawasaki's. So Kawasaki, we give aspirin to. It's the only time in children we're going to give aspirin, but of course we're being watching that child very, very closely. It's caused by aspirin. It's a metabolic disorder in children, and most of the time we are not giving aspirin except in that one case, Kawasaki, because we need to stop clotting, thin the blood, and also decreases inflammation of the vessels. Febrile seizures usually occur in so febrile seizures is usually 6 months to 6 years of age and right around there, and then they usually will grow out of it. Something that we could tell our parents that they're not going to live with that for their whole childhood. Childhood hypopituitaryism results in which conditions? So you know it's not gigantism because there's two of them there. Forgot to change that one, sorry. But in hypopituitary, pituitary gland secretes a hormone which helps with growth. That's why we can give growth hormones, which act like the pituitary gland, but less than what they need is going to have a small child, so dwarfism. And then, of course, hyperpituitarism is the gigantism. How would you describe precocious puberty? What does precocious puberty mean? You know, we know that males and females do go through puberty at a certain time. But in precocious puberty, these children go through puberty early. You can see young boys 6 years old with beards, part of puberty, or we could see young girls, 5 or 6 with breasts. And we don't want to see that because of, other children teasing and, they still need to be children at that age. So we can give Lupron, which will stop that puberty until that time where they should go through it, whether 10, 11, 12 years old, depending on what the physician wants to do. Congenital hypothyroidism. What's that due to? As I said, congenital means at birth. If we don't treat it, we're going to have cognitive dysfunction. You're going to have delays, and of course, growth delays also. Child's going to be small. Females are more than males, and it could be due to mom not having enough iodine levels. So it could be maybe corrected with giving iodines. But as I said, if we don't have the telltale signs, there's no history, and there's no stool, we're going to be checking for hypothyroidism and, of course, that cystic fibrosis. What acid-base alteration would you see in a diabetic child with Kussmaul's respirations? Well, we know Kussmaul happens from diabetic ketoacidosis. So the body's in a metabolic acidosis. So you have metabolic and you have respiratory. So the lungs are trying to do something to go against that acid. So it does the opposite. It's respiratory alkalosis. It's trying to counteract. The body's trying to say slow, big breaths, right? This is slow, which means it's alkalotic, trying to correct that acid. Okay, does that make a little sense to you now? Why it is that? Because your metabolic acidosis, opposite is respiratory, so we'll go alkalosis. You will see acid base on your HESI. So what is hypothyroidism? I think there was 3 or 4 acid-based questions on the last HESI. So it's something why I'm throwing them into my Kahoots to show you what could be what and to make you think of it. Not a memorization, but to understand it. So hypothyroidism is just basically not enough hormones coming from the thyroid. So we need to replace it. A Multiselect. What would a child with Cushing's syndrome look like? Well, Cushing's syndrome is the adrenal glands. Adrenal glands do what? It secretes cortisol and aldosterone. What is cortisol? And what is Cushing's syndrome? Why do you get it? Well, if you were like me with rheumatoid arthritis and had too much prednisone, you'd go into Cushing's syndrome and gain 80 pounds. Big face, the humpback, just, a little bit of a belly was going on, all due to prednisone. So Cushing's syndrome occurs not from what you have inside the cortisol, but something you've taken in. And remember, all prednisones, when you give them, must be tapered off very slowly. And children do get hair growth, things where they shouldn't get. Of course, that big round face, and of course, they're big and full, stocky. It's a good word for it. Seizures in children most often are the result of what? So seizures most often are that febrile seizure, which is an abrupt rise in the body temperature. It's called the rate of rise. You go from no temperature, 20 minutes later, you have 101, and that sparks the brain to go into a seizure. In some children, not all. Autoimmune disease of the thyroid gland. Many times this is females, late childhood to adolescence, find out that they have a problem with their thyroid gland. It's autoimmune, no surgical process with this one. You cannot remove this thyroid gland. This is called Hashimoto's disease, and this requires thyroid replacements. My daughter-in-law has Hashimoto's, and she's constantly in a battle trying to find out the combination of what's the best thyroid medications to use and constantly getting levels checked. Addison's disease, opposite of Cushing's disease. Adrenal gland again. What does the adrenal gland do? So if Cushing's too much, Addison is too little, right? So this is decreased secretion of cortisol and aldosterone. And how do these children live with Addison's disease? Well, they're going to be on some sort of steroid. And in times of stress and sometimes when they're sick, they're going to need an extra dose of the steroid in order to get them through the time. A multiselect. A ventricular peritoneal shunt. And the ventricle is the fourth ventricle in the brain. And it's that little butterfly looking thing. And if you look, that tube goes in there. And what sometimes happens in children, the connection valve to the spinal column and the spinal nerve, spinal fluid can't drain. So the head blows up. You're going to see again distended neck veins, big fontanelle bulging when they're sitting there and quiet. And this shunt connects that ventricle, goes behind the ear, and there's a pump there that you never, ever, 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 ever touch. And it goes in front of you and it goes into the abdomen. Nursing care. Well, you're going to monitor head circumference. That's number one, but also abdominal circumference. And of course, with any of these children, keep their hands away from the shunt. Only neurosurgery can touch it. Sometimes they'll pump it if they're seeing it too big. Maybe sometimes it gets clogged, but only them do that. And that's used for hydrocephalus, too much water in the brain. A common side of Graves' disease includes blank or protrusion of the eyes. Graves is too much thyroid. I had a girlfriend who had big eyes, but she had nothing to do with her thyroid. It was just familiar, hereditary. And everybody always asked her, you have thyroid problems? She goes, I'm tired of answering the question. But anyway, it's called exophthalmos, big bulgy eyes. They now have eye drops and stuff they can take to try to decrease that so it's not so bulge. A multiselect. What are signs of hyperparathyroidism? Well, what does the parathyroid do? It regulates calcium in the body. When you think of calcium, magnesium, think of muscle spasms, tightness, tetany, paresthesia, all of those things you're going to see with hyperparathyroidism. Does that make sense? Calcium, this is what it does. Calcium, magnesium, we use calcium channel blockers to help the heart beat better, but it's also the calcium that's in the muscles, in the legs and the arms also. So parathyroid calcium. A multiselect. Hypoparathyroidism has the symptoms of tetanic muscle contractions and what? After that explanation, what are you going to see? Hypo. So that's the word to put in front of the calcium. Hypocalcium. What does that mean? So not enough calcium, you're going to have that muscle weakness, tetany, because you don't have it to contract. You need calcium to be able to contract. You don't have it, you're going to have weak legs, muscles are weak and they're going to be spasming, and it's due to low calcium levels. What does the parathyroid hormone do? Yes, it's that regulation of calcium, parathyroid calcium. Good. Which of the following might be a cause of an adrenal crisis? Addisonian crisis. Well, what do we know about the adrenal glands? We've got two different things there. And what does the adrenal glands do? We have Cushing's, we have Addisons. So adrenal crisis is usually when you're on steroids and instead of tapering them off, you stop them. And then your adrenal gland says, I don't like that. And it goes into this crisis. A multiselect. Congenital hypoplasia, parent teaching should include. Well, when they're talking about congenital hypoplasia, they're talking about the hormones which dictate what an infant will be, a boy or a girl. You will see infants. I've seen one with a protruding clitoris and testicles. I've also seen a penis with a vagina. And what they need to do is determine what are they going to make this child. So at birth, these parents don't know if they had a boy or a girl. They have to decide what they want. They'll never have children because they don't have the body parts because they're sort of both. They're going to have to be said, all right, it's a boy or girl. And these children are going to be needing cortisol, aldosterone replacements for life. So it's a very difficult time for parents. I've seen one in my early newborn career, and it was, I didn't know that that could have happened. You don't know everything when you become a nurse.
Can you wait until they're older to let them decide, especially this day and age?
What causes type 1 diabetes? 1 second, Mona. So type 1 diabetes has to do with the insulin in the body is not sufficient enough to change carbohydrates into something that the body can use. So you have all this extra sugar in the body and the body's hungry, right? It needs something to eat. So it says, you know, there's proteins in here, and it starts eating proteins. Byproduct is ketones, and that's why diabetic ketone acidosis. If you don't have sugar, let's go to some other body fuel, which is the proteins. Now that question, Mona, they have different types of genitals, and usually they'll do it at birth. Can they wait? I don't know if it's the best thing, especially when the child gets older enough to know if they're a boy or a girl. I don't know if they need it on the birth certificate. I don't know. It is a great question. Now you're going to make me go research that. But I wouldn't want to be that parent, you know, to try to have to decide.
I know I wouldn't, especially now that, what if you say, oh, it's going to be a girl. And then all of a sudden, later in life, they decide they want to be a boy.
Maybe that's all of those, reality TV shows that are going on now, Jazz, who's a boy, who's a girl, who knows, that could have been part of it. And that makes me wonder. It really does. All right, let's go. Which statement about a pheochromocytoma is correct? So it is a tumor. It is on the adrenal gland. And there are certain symptoms that occur because of it. Remember, this tumor secretes like catecholamines, sympathetic, which is heart rate up, blood pressure up. And it's all of a sudden people are feeling their heart just beating up in their chest and get a headache because their blood pressures go so high. And it's intermittent. So it's very difficult to catch. They usually put them on 24-hour monitoring, Holter monitoring to try to catch it. And then they'll go and they'll figure out it's a pheochromocytoma and they need to remove it surgically. So as a nurse, you know your patient has this, you need to be monitored very closely for their vital signs. They're probably on a monitor, monitoring their blood pressures. What action should the nurse implement in the care of a patient with a pheochromocytoma? So we know pheochromocytoma, it has to do with catecholamines being released. Yes, we're going to monitor for hypertensions. And, you know, if the child's old enough, they can tell you what they feel. A Multiselect. Nursing care of the unconscious child include. Now, nursing care of any patient unconscious requires all of these things because these children or adults, they can't tell you what's going on. And unconscious means there's something going on with the brain. So strict intake and output, too much fluid in the brain causes extra pressure and you don't want to do that. So monitoring fluid going in very carefully, even flushes and everything you'll monitor. Neurosigns for sure, because it can show pressure, and vital signs every 2 hours. Pain control, it depends on vital signs, but your basic thing is INO, vital signs, and your neuro checks. Symptoms of diabetic ketoacidosis. So remember, it's diabetic. That means insulin's not being produced. So your body can't use sugar. So it's building up in the blood. So you have high blood sugars. And then the body says, you know, I'm just really, really hungry. So what else do we got in here that we can eat? So we have proteins. So they start eating the proteins up. And then because they eat proteins without sugars, ketones are formed. So you have elevated blood sugar with ketones in the urine, and that makes diabetic ketoacidosis. And that fruity breath, it smells like if you had a Tupperware container and you put a peach in there and it got rotten. If you opened up the lid, that sweet, rotten smell is exactly what that breath smells like. It's very distinctive. You can smell it from quite a bit around. So blood sugar up, ketones, and that fruity breath, absolutely. And we're probably cousmoling at this time to try to get that acidosis down. Diabetic ketoacidosis is caused by, after all those explanations, which one? So no insulin, you got to eat something else. So we're eating the other fuels, which is your proteins. Ketones, you know, yes, it becomes acidotic in the body, but what is diabetic ketoacidosis? The description is lack of insulin and your body uses other fuels, protein, and ketone happens to be the byproduct. A diabetic child is complaining of feeling jittery. The blood sugar is 45. What's this best treatment for this child? What would you do? You know, these keywords in this question is they are complaining. So if they're complaining, their blood sugar is low, give them orange juice, glass of milk, doesn't matter, give them something to help that blood sugar come up. Your patients experienced a head injury. What would most concern you? Head injury, we know head injury creates swelling in the brain. What can happen with your head if it swells? Remember inside there is a pituitary gland, and if it gets squeezed, your urine output's going to decrease. So excellent, very good. It is decreasing urinary output. It's just like using mannitol for cerebral edema. Yes, this is what we're going to do. A Multiselect. What would alert you that a child's head injury is deteriorating? I mean, they have a head injury. What are you going to see? Well, we already know that amnesia thing. We've talked a little bit about that. We know a kid with head injury is going to have nausea, vomiting, and a headache, but when they get to the point where they're getting restless, now we're getting, you can't talk to them, they're not understanding, they're getting restless, a little bit rowdy, and then it gets to the point of difficult to arouse. We know that's definitely something's going on, deteriorating, there's more pressure going on in that head. A child's been diagnosed with bacterial meningitis. What is the nursing priority of care? I mean, we need to do a lot of things, but what's number one? And it's antibiotic. Okay, you have an infection in the brain. Number one priority, administer the antibiotics as ordered. What is the primary cause of injury associated with submersion? You're talking about drowning. We talked a little bit about this last week about kids get up and run around and they still can have an injury up to 72 hours later. So what is the primary injury that they have? They're on the bottom of the pool. They're not breathing. It's hypoxemia. They're not breathing, lack of oxygen. That's number one. A Multiselect. Which CSF lab value correlates with bacterial meningitis diagnosis? Now you do an LP on a child and you're seeing your cerebral spinal fluid looking cloudy. Sometimes it's so milky you can't even see through it at all. It looks like milk. You know you're in trouble. White counts could be 10,000 and that child's sick. But what you're going to see is elevated proteins, and then the bacteria loves glucose, so it eats it up. So low glucose, elevated proteins. Decreased WBCs, oh no, increased. Decreased RBCs, you shouldn't see RBCs in a cerebral spinal fluid unless they hit a vein on the way in. Last question. Hyperfunction of the pituitary gland in pre-adolescence results in, what's the name of hyper? We've talked hypo. What's hyper? And that's gigantism, yes. So let's see how we did today. Number 3, Mary. Good job, Mary. Been a good day. And then we have BCS, and number 1 is an LP. One more puncture, okay. And then Kim and Mar. Okay, guys, what I want you to do is sign your attestations, make sure you get them done. This week, we know that you do have a discussion question that is due, and make sure that gets done. And we have the ALL case study, and the dosage calculation. You can take pictures and send it whichever way you want to do it. There's multiple submissions on that one to make sure whichever way you did it would be okay, so that you all be fine. So thank you guys. I will see you next week. If you need anything, please, please,
Are you
please.
posting this on YouTube?
Excuse me?
Are you posting this on YouTube?